Cancer Awareness Month, and this morning we're talking about everything from risk factors to lifestyle choices you can make to reduce the risk of breast cancer. Here is everything you need to know in women's healthcare. Expert and author Dr. Jessica Shepard. Welcome to the show.
Yes, I'm so glad to be here. Yes.
Okay, so let's get started. Breast cancer is the most common cancer among women.
Yeah.
What are some of the things we need to keep in mind?
Yeah, you know, breast cancer, 1 in 8 women will have this in their lifetime. So obviously this is something that we really need to pay attention to, but it's also key factors on what we can do outside of our everyday life to make sure that we're decreasing that. So lifestyle factors are a big thing, but there are also risk factors that we can't control, such as age. 55 and older is when we start to see those numbers rise. Family history is also very important in making sure that you understand that. But also weight gain. So women in their midlife really do start to increase in weight, and we'll talk about that a little bit later and why. But obesity and weight gain do have some of those things that are going to increase the risk. And then the foods that we eat, right? What are the foods that we're eating? And then also hormone therapy, but namely when you start and what type of hormones you might start to take. Last but not least, smoking and drinking.
Yeah. Those are the killers.
Nutrition. Let's talk about nutrition and how that relates. How much of a role does that play?
It plays such a big role. And if there's anything, even with my patients that come into the office, is really honing into the fact of what you do and how you fuel your body is going to impact how you decrease diseases such as breast cancer. So looking at foods that are going to help, such as diets that are going to contribute to not high processed foods. Making sure when we talked about weight gain, as we start to go through midlife, women start to increase with weight and fat content. So we want to make sure that we're increasing our muscle mass. And so the way that we're going to do that with our diet is increase our protein, looking at our protein intake.
It's so hard. Protein is...
It's a job.
Isn't it so hard?
It's a job.
Job.
It is, yeah.
Figuring out
It's my part-time job now, looking at my protein intake,
So what is the best type of diet? Like what to limit besides processed foods?
Yes, I'm glad you said that, because diet, when we look at diet, not the fad diet and what you're trying to eliminate.
People don't understand. It's like when you say diet, it's not like a diet to lose weight. It's like what foods do you
be
eat
putting in
that is your
adding in the foods. And when we look at foods that like contributory and a collective, the Mediterranean diet really is going to be the one that's really reflective of increasing like your omega-3 fatty acids, your protein, and then decreasing some of those high processed foods.
How about exercise?
Oh my gosh, that's my favorite word. Yes, because exercise is medicine.
It is.
And we talked about increasing our muscle mass because women automatically will start to lose muscle mass in midlife. So what can you do to increase that? That's your resistance training, anything such as plyometrics, your HIIT routines, high intensity, and then also weights. I always tell my patients, lift heavy weights. And you won't bulk up, you're increasing your muscle mass and decreasing fat.
It's so true. It's funny, when I was younger, 10 years ago, it was so cardio based. Everything was cardio.
Everything was cardio, an hour on the treadmill.
The older you get, it's like it's almost no cardio. Now it's all resistance, all weights.
Protecting your bones and making sure your balance is on point.
Okay, we're going to take a break. More tips on breast cancer prevention with Dr. Shepard when we come back. Stick around.
We're back with Dr. Jessica Shepard. We've been discussing the importance of breast cancer prevention. So take us through like self-exams. How often should we do this? How do we do it?
Self-exam, I really like to say, is not that it has to be so technical, but body awareness. So the more that you do self-exams, like once a month, you're going to know your tissue. You're going to be able to find, is this lump bigger? Is there tissue that's going to change in appearance? Those are the things that we really want women to be looking for so that they can go to their doctor.
Okay, best way to screen for breast cancer?
Mammogram, by far, that's the gold standard. We've really done so much in technology and innovation, how it detects, because early detection is key. And so we've actually changed the recommendations this year from 50 years old to start with mammograms for 40. And we want you to get that every year.
So a baseline.
Baseline, and the caveat to that is if you have a strong family history with any genetic predisposition or any, genetic BRCA genes, you want to start earlier, even as early as 25. What is that going to include? Possibly mammograms and an MRI to make sure that we're going to get early detection.
Well, these are all, this is like all great advice. very important information. You should also pick up Dr. Jessica Shepard's book, Generation M. It's available everywhere, and it's available now, so make sure you pick it up. Thank you so much for teaching us, informing us, reminding us.
Coming up next, we're going to open up that inbox. Stick around.